Med-Surg nursing is empowering. That's what it is. It's a multi-specialty that empowers you.
It does. And it really teaches you, you get to see a little bit of everything, so you kind of know what you do and don't love. That might actually be the stepping stone to you going into oncology. You get to see a little bit of everything and kind of figure out what you do love.
Hi, everyone, and welcome to New Jersey Nursing Insights podcast. My name is Sue Weaver, and with me is my co-host, Daria.
We're your hosts from the New Jersey Collaborating Center for Nursing, and we're excited to get right to it. Today, we're diving deep into a specialty that is the backbone of almost every hospital, medical surgical nursing.
That's right, Daria, and we're very pleased to welcome two nurses from Atlantic Health Newton Medical Center, Brooke Roth and Parris. Will you take a moment to introduce yourself before we get started with our questions?
Sure, I can go first. My name is Brooke. I am from northern New Jersey, lived here my entire life, and I've worked at Newton Medical Center for 8 years.
Good morning, everyone. My name is Parris. I'm originally from the Bronx. And then I came to Sussex County, which is in northern New Jersey, about 18 years ago. And I have been with Atlantic Health for almost 6 years now.
Well, we're excited to get started. My first question for you is, when you tell someone you are a Med-Surg nurse, what is their reaction or what is their response?
I feel like when I say that, it's like, oh, okay, you're a nurse. There's not that excitement or enthusiasm or like, wow, you're an ICU nurse. So it takes me a little bit back, but that has brought me to my passion of why I love Med-Surg nursing so much.
How about you, Brooke?
I usually follow it up with, I work on a Med-Surg unit, and then I explain what that is because most people don't know what that means. They just hear that and they think I only take care of patients who just had surgery, but it's so much more than that.
So it sounds like there's a lot of misconceptions?
Definitely from students and anyone who's thinking about going into nursing. I feel like Med-Surg nursing gets a bad rap only because historically it is what they said you always should start there because it's where you build your foundation. But it also used to be like, oh, you're a Med-Surg nurse. You can have 7, 8, 9 patients. It's not really a big deal. But that's really not how it is anymore. So I think it's up to us, those of us that do work Med-Surg, to change those misconceptions, especially for nursing students. But I'll get more into that when we talk more about our floor and how we've changed things.
And I would just chime in the same thing. I think besides the nursing students, also the families, a lot of them just assume from past experiences that we may just be taken of, dementia patients. Sometimes in their eyes, we're almost like a notch above like a nursing home, but they don't realize all of the high acuity patients that we take of and like the wide range of them. So just being able again to educate, I think, family members, patients, and starting from nursing schools is very important.
What originally drew you into becoming a nurse?
Okay, I am in my 40s and I only became a nurse at 38. So I've only been a nurse for 8 years. But originally when I was in high school back in the 90s, I really thought I wanted to be a nurse. And I was just too scared because of the science aspect of it. Science is just not something that ever came easy to me. And I ended up becoming an elementary school teacher. So I did that for about 5.5 years. And then I ended up being a stay-at-home mom for 10 years, which is really my favorite thing out of anything I've ever done. But I had the opportunity to go back to school. I had the support from my family. So I did it. And I was really motivated because I had such a great labor and delivery experience at Newton, actually, with my first daughter, who's now 18. And I had such a great experience with nursing both of my girls. So I wanted to become a lactation consultant. And that was really what drove me to go back to school. And then once I started taking all the science classes, I was like, oh, science doesn't come easy to anybody. You actually have to study this. It's not like division where you learn how to do it and you know it for the rest of your life. It's not like that. So it was a major challenge for me, but I did it. And then what happened was I'm always under the idea that you should take whatever job you can get and to get your foot in the door, right? So I was like, yeah, I really would love to be a labor and delivery nurse, but this Med-Surg opportunity came to me, and that's where I stayed. So that's how I ended up becoming a nurse.
Okay, let's switch to Luz. Can you explain sort of how you ended up in Med-Surg? Did you choose Med-Surg, or did Med-Surg choose you?
Well, I've always known that I wanted to be a nurse. It was the thing from high school that I was like, I'm going to nursing school. But fast forward, I started as an LPN and then eventually went back to school. So I had a little bit of insight between GI, GU. I've worked for pulmonologists, just different aspects. And I applied to Newton. And so Med-Surg essentially picked me. And I was like, oh, great, I'll start there. I wanted to do the ER. And then once I got into Med-Surg and I saw, again, the level of patients that I was dealing with, the different things, which is what I needed. I needed that adrenaline rush, and I needed that it wasn't just the same type of patient. So I was never one that I wanted to focus on like one specialty. I wanted a variety, and Med-Surg chose me and gave that to me. And that's why I've stayed, and I will continue to stay.
Is there a particular moment that made you realize this is where I want to be?
There was a particular night. It was a rough night, and I will never forget this because it may have been emotionally one of my lowest moments. It was during, we had COVID patients. I had a 10-patient assignment, and I had 6 of those were COVID patients. I had one that needed to have blood transfusion and 2 others that I had to call an RT at the same time. And my daughter was in the emergency room. And just seeing the team that came around me, and it took me a couple minutes. I did cry. I'm not going to lie. I cried for a minute, and then I got myself together, and I was able to, okay, everyone said, what can I help? Okay, I need you to do this. You take care of this one. This is my most critically ill patient. I'm going to handle this one specifically. And just seeing how I was able to just overcome all that, regardless of my personal issues going on, knowing that my daughter was sick downstairs. But I knew that there was a team because, again, having worked at Atlantic Health Newton, I was starting to see that, right? How everyone just is supportive. I was like this after that day, and I went home. I was like, you know what? It was a rough night, but everyone came together, and I got what I wanted. I got that in any moment, things can kind of go south, but I was able to handle it. And with everyone's support. So I was like, this is it. As rough as it is. And most people, right? You think, oh, everything should be great. It should be, roses and butterflies and stuff. And it wasn't, but that made me such a better nurse. And I was able to say, you know what? I can do this. And this is what I want. So that was the moment.
Wow, that's a great story. And it sounds like that was an empowering moment as well. Just seeing that you can prioritize, you can get the support from your unit to get through that day, as bad as it was in that moment.
Absolutely.
Thank you.
Just to follow up, Luz, think about if you had a student nurse follow you for 12 hours, what would surprise them? What would shock them? And also, what shift do you work?
So I am a night shifter. So I'm one of the night owls. So it's a little different on the night shift than it is on days, but we do always train on days first. So with the day shift, even when I start as a higher learner, so you have your morning rounds, you have family members, you have PT, OT, dietary, everyone that needs your attention. I think what was most surprising for me, and that would be even for nursing students, is even though you think you can't critically think, when you're put in those situations, even if you have a moment and you may need to cry or you may need to go and scream in the bathroom for 10 seconds, and you don't necessarily do it in that moment, you could do it afterwards. But knowing that everything you learned in school, you have the skills, you were given the tools, and then it's up to you to be able to use them. And just to know that I can do it, right? Science was always something that I was good at until microbiology, right? Like Brooke had mentioned. But nursing is something that's always evolving and you're always learning something. So I think nursing students, or the misconception, not just from students, it's right. You learn something in nursing school and that's it, whatever the book says. What's surprising is that what's in the book is sometimes very different from what's in front of you when it comes to the patient. So those critical thinking skills, being able to, in a second's notice, act and address a situation or delegate. That was another thing. You always hear about delegation and you need to be able, and I was the type of person I'm like, nope, if I don't do it myself, then it's not done right. I can't trust nobody to do it. And there's still certain things that absolutely not I have to do, but you learn. And I think that was surprising also because you learn to be like, you know what, it's okay. You know what? This is my fellow nurse. We're in it together. We're a team and it's okay to delegate and do stuff like that.
I love how you continue to spotlight the team approach. I think that's really important. So for this student nurse or nursing student who's following you, if you were to explain to them, what is the hardest hour during the night shift? What's the roughest period?
The bewitching hour will always be between, or hours, I say, because some will say 2 to 3 a.m. and some will say 3 to 4. For me personally, it's always 3 to 4. For whatever reason, that moment is you finally have settled, because the misconception is that people sleep at night, and that's completely not true. In the hospital, no one sleeps, but 3 to 4 a.m. it's you've settled everyone, you're trying to get your chart in. You may or may not have had your break, but your body, and a lot of my fellow nurses on the unit, we're like, we got to get up because it's a struggle to just be able to keep going because your body is saying you need to go to sleep. That's it. You've been up, and just being able, and that's when things, I don't want to say the forbidden word, but they quiet down. So yeah, I'm not at work today, so hopefully it's not a jinx, but between 2 to 4, but really that 3 to 4 a.m., that is the toughest hour to just be able to physically, emotionally just stay up and stay sharp and, still do the things you do. And then you're like, all right, we're almost there. We're almost at 7.
Well, thanks, Luz. I admire you working the night shift. Thank you very much. And Brooke, now, so how about for you? If a nursing student would follow you for 12 hours, what kind of patients would she see? And what would shock her or him?
So on our floor, because we are a smaller community hospital and we have 69 beds, we basically get the bulk of the patients. So you really are going to have patients who have all different diagnoses.
Wait a minute. I have to ask you, what did you say? How many beds on your unit?
69. It's huge.
Wow.
It's a huge. So it used to be, long before I came along, it was 3 separate units and they merged it into one. So it is very big, and most of the rooms are semi-private. We do have, I think, 20 something private rooms, but the rest are all, in my eyes, double, but they call it semi-private. So yeah, it's a huge, huge unit. So we do get patients of all different kinds. So you could have an assignment where you have a patient who has a CBI running because they just had neurosurgery. And then you could have a patient in the next room who just had a total knee replacement. And then you could have a patient who's on comfort care. And then the next patient has a diabetic ulcer that you have to do wound care on. You could have someone who has an NG tube and they're getting TPN, or it's to low suction. So you really could have people who have all different body system issues and different needs. So some people need pain management. Some people need just comfort. Like you need to not just comfort the patient, make sure they're comfortable when they're passing. You need to comfort their family too. So that's actually one of the things I love about hospice and comfort care. One of the things I love about our floor is we do a lot of that. And it really just keeps your skills up. You really are constantly having to switch back and forth between how you're caring for your patients because they don't all need the same thing. And we do get a ton of nursing students on our floor, which is a beautiful, beautiful thing because they see how well we work together. And I think for day shift, when you're a brand new nurse or nursing student and you come and see what's going on, I think you're probably surprised by how much you get interrupted. You know, you have this set plan, like if this is how I'm going to go about my morning. And in a perfect world, you have it all set up so that you can do everything in a timely manner. But then someone has to call an RRT because the patient's having chest pain, or the family's calling and you can't get them off the phone. You're on the phone with them for 30 minutes and you got to talk to them because they're upset and you got to calm them down. And then you get off the phone and you're like, all right, cool, I'm going to go get my meds. And then PT comes to see you and like, can you help me get the patient out of the bed? So there's just constant disruption. You have to be really, really good at multitasking and delegating and keeping track of everything that you are doing and when you're going to do it. And really never hesitate, like never be like, you know what, I really just want to take like a 10-minute break. When you have all these things hanging over your head, you have to figure out how you can work around that and get things done when you have the opportunity. Like, for example, if you have a patient who's being discharged at 11 a.m. and it's 9:30 and you still haven't done the paperwork and you have the time to do it, do it. Don't wait, because sometimes they show up early. It's rare. They don't usually show up early with transportation, but sometimes they do. So always have to be like at least a half to one step ahead of where you think you should be in your day, because it's constant disruption. It's constant go, which is what I like too. Like, I would never want to work in the ED because I feel like in ED you're never done. I love a good check box. I love like when everything turns green because I did it. And in ED, you're never ever able to do that because you get new patients constantly. So that's why it wouldn't work for me. But the beauty of this is that you still get that quote unquote chaos because of working with all these different types of patients, but you can focus on just those 5 or 6 patients instead of being in the ED where you might, I don't know, have 15 patients throughout the day.
Well, thanks for painting a nice picture of your day, your shift, but that chaos, I hope you do have time to take a break.
Oh, yeah.
Okay.
Yeah.
Good. There's an idea out there that Med-Surg is a stepping stone before you move on. Is that accurate?
I think that is the misconception from many years ago, because I think that was what people thought. Like, oh, you start here, you get your skills, you move on to the ICU or labor and delivery or the ED even, because those units don't typically want brand new nurses unless they have a residency program for them, just because they don't have the time commitment that a new nurse needs to be trained. They can only do it for so many people. So they want you after you have your experience. But it doesn't have to be a stepping stone, because there's so many things that you can learn while you're there. And if you're on a unit that helps you grow, whether that might be maybe you become a charge nurse or a preceptor, or they get you involved in shared governance, which we're really big about at Atlantic Health Newton and Atlantic Health in general. Very strong, robust shared governance committees throughout all of our hospitals and on our units. And if you can show people that there's the ability to become like a change agent on your floor, someone who sees an issue and helps make it no longer an issue and solves the problem or quality improvement project. So there are always opportunities within Med-Surg to grow and become more than just working at the bedside, although that is something that some people just want to do. They just want to work with the patients. They don't want to do any of the extras. But then for those of us that do, there are opportunities there. You don't have to leave to grow.
And just to chime in, I do think, right, it is a misconception. It's just a stepping stone. And then, you do your time and then move on, because people don't realize that there's so much that you can grow. And like Brooke was saying, yes, you can become a charge nurse. You can become a preceptor. On our unit specifically, and a lot of units, I feel like some hospitals, they just don't classify it as a Med-Surg unit, but we get our ortho patients. You have bariatric patients. We have a pulmonary unit. So we have a group of nurses that gets additional specialized training in pulmonary diseases, how to handle high flow, medium flow, and all these things. So you have to use your critical thinking skills. And for some, they're surprised, right? You may think, oh, I just want to go do maternity. But once you step into our multi-specialty, because that is what Med-Surg is to me, that is what the MS stands for, right? Not Med-Surg, it's a multi-specialty. It's, you get all these patients, and you can be a certified medical surgical nurse the same way you can be a certified critical care nurse. So there is certifications out there. I feel like we need to romanticize Med-Surg, and it's not just a stepping stone, because you can have a long, fulfilling career in Med-Surg and different aspects. And whether that's leadership within a Med-Surg unit, or if you want to be at the bedside, but still be involved in those shared governance committees. And like Brooke said, be a change agent and be involved with process changes, policies and all that stuff. Med-Surg offers that. So it's not just, that stepping stone. It's so much more than that.
Well, thank you. I like what you said about MS, multi-specialty.
Yeah. Same.
And we know that there's a national organization, the Academy of Medical Surgical Nurses, and they definitely advocate and consider medical surgical nursing a specialty. So it sounds like you agree with that.
Absolutely.
Yes.
And what skills do you think Med-Surg nurses master compared to other specialties?
I think advanced critical thinking, because you don't just focus on one body system. You have to be able at any moment focus, and Brooke mentioned this before, on whether this patient has a GU issue, this one has a respiratory issue. All your patients are so different, and some can be surgical patients. So you have to also have those skills, for a post-op patient, and how do you manage them? IV skills. IVs is one thing that on the medical surgical unit, because we also deal with our dementia patients, our Alzheimer's patients, which we come to love dearly, but they love to pull out their IVs, or we have those patients that are just those difficult sticks. So you learn, and we do have some champions on our unit specifically that they're masters, and they can go in and, I swear, with their eyes closed, put in an IV. But it's from the technical to even the emotional skills, because you have to learn to deal with different generations, different families, attitudes, beliefs, whether it's religious, backgrounds. So I just think a medical surgical nurse, the skills, you're more well-rounded.
And I would add, you really have to be great at prioritization. You have to be able to know like which patient needs you the most, or you need to check on the most, they need to pay attention to the most, because you can have someone go downhill pretty quickly if you're not paying attention. And you really want to make sure that you're aware of that. And maybe if you have a patient who has a lot of medications, you want to start with them over the one who maybe has 2 or 3. So it's really important to know your patients and, how sick they are, because they are all levels of illness. There's people there that are, you might get them in the morning and they're going home that day. So they're not really sick anymore. And then you might have someone who just came in 3 hours before you started who is really, really sick. And that is how you have to figure out, okay, who do I need to pay attention to the most? Who am I most concerned with? And then kind of prioritize. And then also task prioritization. Like, is it important if I have someone who needs blood? Is it more important for me to give them their blood right now? Or is it more important for the next door patient to get their Colase? So you really have to be sure that you know what is the most important thing in the moment. Or as the day goes on, it changes.
Speaking of how things change, Brooke, I'm wondering if you can reflect upon a shift where things really quickly changed. Maybe things started calm and really started to unravel and become chaotic, or when maybe you really needed to put in your prioritization skills. Can you think back of a particularly memorable day or shift that you experienced?
Well, I'm trying to think of a time. I don't want to scare anybody, so I don't want to give you like my worst night that I ever had, because I definitely had one of those. I think it was more when I was charge nurse a lot at night, because I used to work nights when I first started. I think it was more about when I had to be charged and we were already short-staffed, But listen, our staffing now is amazing. So I just want to highlight that. I don't want anyone to be scared if they're listening to this. But back when our staffing wasn't great, especially COVID times, I can recall a night that I had a nurse who came to, she called a code blue on her patient. And they had COVID. So at the time it was like, we're not sure what are the policies. What are we doing? Because it was a little different. Everyone was worried about getting COVID, right? So you had someone come from anesthesiology because they had to intubate them. And then the next patient a few rooms over, literally we just finished this code. They were going to move to ICU. Then she had to call an RT on her other patient who we ended up stabilizing and keeping on the floor. And then it just seemed like every time we would get, okay, we could take a breath, something else would happen. We get another patient from the ED because as soon as we lost that patient to go to the ICU, the ED was like, hey, I got one more for you. Here's another COVID patient for you. I actually remember joking with the nurse. I said, okay, well, you lost one. I'll definitely be giving you the next admission. I was totally kidding because she was completely overwhelmed. And I think I ended up taking it for her. But I think as charge nurse, you really have to also be able to really prioritize like who needs you the most too. But that for me as charge, I feel like I was more overwhelmed trying to meet everyone's needs because you want to be able to help everyone and you can't. Because on our unit, we really try not to give our charge patients because it's so big and we can have 60 something patients on the unit at any moment. So you really need to have a nurse who can come and help you without having to worry about what their other patients they have. So for me, it's more chaotic when I've had to be charged than it was when I was on my own.
Thanks, Brooke. And thinking back a little bit more, reflecting on skills again, what do you think is a sort of underrated skill that nurses in your unit really have fine-tuned because of the nature of the breadth of medical conditions you treat, because of the size of the unit and all the things that are going on and all the nuances? What skills do you think your unit would be particularly good with?
Do you consider teamwork a skill? Because sure. I think that our teamwork is absolutely amazing. And when I was on night shift, I can remember times walking into a patient room and having like, let's say a patient who was incontinent and it's just everywhere, right? You need someone to come help you. And I would be like, okay, I need a little help. And all of a sudden you'd have 4 people in the room. Someone brought the new sheets. Someone brought hot water and towels. Someone else got a new gown. Like we didn't even speak to each other. We somehow, and they were like just turning the patient, cleaning them, getting them back and sorted out, making them look pretty again. And we didn't even have conversations. And that's just about someone being incontinent. But then you would have those scenarios where maybe you're like, I'm really worried about this patient. And you come in and everyone would be in there and we somehow would manage it. We just never really have to talk. We talk without using words. And I think that's really impressive, especially because we do have new people who start with us all the time. And I see it on days too. We just somehow communicate without even saying anything. Or if we do, so for example, they'll be like, all right, you do this, you do that, you do that. And we just do it. Nobody complains about it. Nobody says, I don't want to do that. We just do it and it happens. And it's why we work so well together. And it's why a lot of our nursing students apply to our floor because they want to know that they're going to be supported. And we support you whether you have been there for 40 years or you've been there for 10 minutes. We are all there to support each other. And I think a lot of our travel nurses that we've had over the last few years, we're not using them as much now because we're well staffed, but they even said the same thing, like, wow, like this is such a great unit to work on because I feel supported from the leadership team and my fellow coworkers. So I think teamwork, if you don't have that, it can make any unit you work on really challenging.
And it sounds like your unit has a lot of trust as well.
Yes.
And you're talking about new nurses, but it sounds like you have a lot of retention as well.
Oh, yeah.
We are proud mamas when it comes to that.
30-something years, some of our night nurses have been there.
Wow.
Yeah. And then talking about our newer nurses, they stay. They don't just put a year or 2 in and leave. They stay. Overall, our retention is high.
And what do you think is that magic sauce that you have over there that you're keeping people in a Med-Surg unit so long? I mean, it sounds like you have great camaraderie and teamwork and work culture. Is that what keeps you there?
I think so. And for me, now that I'm in an assistant manager position, your work-life balance is really so important. To me, it's life. Life should come first, right? Your family, your friends, the things that bring you joy outside of work. And then work should come second, also almost equally as important, because if you don't have a job, you can't live your life, right? You need funds for that. So to me, it's letting our team know we value your time outside of work. We respect it so much so that when you ask us for PTO, we're going to do everything we can to give it to you. It's very, very rare that we have to say no. But on the flip side of that, we expect 100% from you when you're here. We want you to be truthful with us and respectful to everyone. And like, you need to let us know if you're having an issue that prevents you from coming to work. Tell us. You don't have to like divulge all of it, but let us know what's going on. Maybe we need to help you take some time off. Maybe we need to help you, tell you apply for a leave of absence. We don't want people to just feel like, oh, I'm going to just call out today because I don't feel like coming to work, because they know you're going to let your team down when you do that, obviously. But if you have to call out because you're sick, you have an emergency, of course, we don't want you to ever hesitate to do that. But you need to everyone's just very honest and trusting with each other. So we know each other so well that you can tell when someone is off. And then you can have that conversation like, hey, are you okay? Do you need to take some time off of work? Like, is everything going all right? I don't want to hate to say it, but like, we are a family, right? I think a lot of people say that about their work, people they work with, but we spend so much time with these people. And I think because we care about them, that higher level, they stay because they feel respected. I think that's why people stay. What about you, Luz? What do you think?
I just want to say, with the work-life balance, that's something, working night shift, that's always very difficult to kind of accomplish. And it was something that even when I started on night shift, I was like, oh, when do I sleep? When do I still have to be a mom and be a wife and do all these things that's expected of me outside. But the culture on our unit, we've work so hard to be able to recognize, hey, night shifters, it's a little different. So one of the things we did, and this was brought up in our unit-based shared governance, this was before I was an assistant manager. So I was at the bedside and I was actually the chair of the unit-based. I said, hey, holidays, it's difficult for night shift to have to work. You were working every holiday, whether it was the eve or the day, but you worked every holiday. And if you're working the eve, you're sleeping all day. Working the eve, you're coming home the morning of the holiday, but you're so exhausted that even if you're up trying to do Christmas presents, if you celebrate Christmas, you're almost not there. Your body's there, but your mind, you're just like, I want to go to bed. So we took it to a vote and we presented, instead of working the eve or the day of every holiday, how about if you work the eve and the day of every other holiday? So if I'm scheduled to work Thanksgiving, I'm working Thanksgiving eve and day. I am completely off for Christmas eve and day. And then I work New Year's eve and day. And then it alternates the following year. And I'm happy to say that it's almost been 3 years, I think. And the staff loves it, because they know, one, they can plan their holidays with their family, and they know that I'm working this holiday, but the next one I can completely enjoy. And they don't feel that almost guilt of you have to work and you have your family and which one's more important, because like Brooke said, they're kind of both. We want to make sure your work-life balance, is personal life is just as balanced as your work. And we do expect that, when you're at work and you give it 110%, but we know that you also have a life outside of work. And how do we give 110% to our patients if we don't give that either to ourselves or to our family? So that's a thing with work-life balance. We make sure, and that's why we're very big, like Brooke said, you ask for PTO, we look to accommodate it as best as we can, because we want to make sure that you're taking care of you as well, so that when you're here, you're given 110%.
Thanks, Luz. I love what you said about, if you can't take care of yourself, how are you going to go to work and be able to take care of your patients? That's an excellent point. There's no better way to say it, really.
Again, I absolutely love our unit, and it is a family. So I just want to make sure that everyone out there, I want you guys to fall in love with medical surgical nursing. It's not just a stepping stone. It could truly be your entire career. So I just want everybody to know it's a multi-specialty. There's so many different avenues. I know nursing in itself, which is one of the biggest reasons why I wanted to do nursing to begin with, right? Because I was like, oh, if I want to, be a chemo nurse, I can be a chemo nurse. If I want to go ahead and take care, of the elderly, I can be, a gerontological nurse. Medical surgical offers that because our unit we also do chemotherapy. So our nurses have the opportunity to do inpatient chemotherapy. They're trained also on an outpatient basis. So you can get that certification. We are also a niche unit, which is, again, we take care of a lot of elderly patients. So we have that, 65 and older population as well. And we have gerontological nurses that are also certified. So we're not just Med-Surg nurses because Brooke and myself, we have our Med-Surg certification, right? We're chemo, certified nurses. I also have my gerontological nursing certification. So I just want everyone to forget everything you've ever heard up until this point about medical surgical nursing and just say, you know what? That's what I want. That's my new love. And just know that at least you'll be exposed to a vast variety of patients and different things that you can learn. And then, we are very supportive. And if you still want to, you know what? I love it here. It's been great. You've taught me the skills that I need to now move on to ICU or now move on into a leadership role. We have your back.
Well, many nursing students are going to be graduating and looking for jobs soon. It sounds like you just made a good campaign for entering Med-Surg nursing. So thank you, Luz. How about you, Brooke?
I would say I think we're so unique for our floor because we're so large and we take every kind of patient that's under the Med-Surg umbrella. So my advice to anyone out there listening from anywhere in the country or anywhere in the world, I would say for Med-Surg type of nursing, you might find a position that's an ortho position, and that is Med-Surg, or a position on a floor that's oncology, and that is also considered Med-Surg. So I really do recommend that you take the leap, especially if you're a brand new nursing student. Don't be scared to try any of those areas because they are all going to teach you the skills and the prioritization skills and hopefully the teamwork depending on any of those types of units because they are all Med-Surg. And especially if you work on an ortho floor, you're going to maybe start with different patients than you with different patients than you started with. So you could come in and have 6 patients and they could all go home and you can get 6 more. So to me, I think that would be kind of exciting, right? Especially because you get to see the whole process of start to finish. But then, you might work on a floor that's a pulmonary unit. I think it's really important to know what excites you and go for that. And if you really want to be an ICU nurse or a mother baby nurse, just know that Med-Surg will get you there. You just have to be willing to put in the time and fall in love with it, at least temporarily, until you can move on. But you might be surprised because I would say I never planned to stay where I am. It was supposed to be a stepping stone for me. I even I tried to leave. I applied when I was still on the floor to be a mother baby or a labor delivery nurse. And, I just didn't get the opportunity. And then COVID happened and I found myself, I won't say I loved COVID, but I definitely felt very useful during that time as a nurse. It felt good to me to know that I had a career that I could help people instead of, my husband was just home. He was home the whole time and he still worked, but he couldn't help anybody because he doesn't have the type of job where he helps people for their healthcare, I should say. He helps them in a different way with technology. And I ended up staying because they let me grow. Like, we have this amazing manager who knew that she needed to keep me interested and growing. So I became an informal leader. I would be helping people before I became a charge nurse. I would be helping people just because they would come to me for assistance. And then I became a charge nurse. And then I became a preceptor. And then I moved to day shift so I could learn. I felt like you could learn a little bit more on day shift. And then I ended up being in this role. And every single role I was in, whether it was formal or informal, taught me something to help me get to that next level. And now I'm at the point where I'm an assistant manager and I don't know if I want to be a manager. I know I would love to be an educator. I would love to be an educator at like a college. I'm currently in school for my master's. And I don't know if that's where I would have ended up no matter where I was, but I do really feel so strongly that Med-Surg has helped me grow to be the best nurse I possibly could be. And I honestly don't think I would have done as well if I had gone to mother baby or labor and delivery, because that would have just been one area. And I don't know if that's the right patients I should have been working with. I really do love that I get to work with patients who are 18 to, I think we've had like a 105-year-old on our floor before. I do love that variety. So
Wow.
I think, yeah, right. It's like, it's so cool that you, not only do you get different types of disease processes, but you get patients from all different walks of life and all different ages and the stories they tell you. Like, that's my favorite. The human connection is always my favorite part of nursing. So I don't know that it would matter where I was for that, but in Med-Surg, you get to see every aspect of life. And it's a really cool place to be. And I am really glad I landed here. Who knows where I would have been otherwise, but I am happy to be here and I plan to stay here as long as I can.
Well, thank you very much for making a good case for Med-Surg nursing. And we know from our New Jersey Collaborating Center data that Med-Surg nurses are needed, one of the top positions that are needed in the state. And hopefully we busted some myths, too, about Med-Surg nursing, that it shouldn't be considered a stepping stone, and it's not floor nursing, right? Or is it floor nursing?
Oh, it's bedside nursing. You're not a floor nurse. You're a bedside nurse, but you're empowered. Med-Surg nursing is empowering. That's what it is. It's a multi-specialty that empowers you.
It does, and it really teaches you. On our floor, you get to kind of see a little bit of everything, so you kind of know what you do and don't love. Like for me, I love hospice. Working on our floor made me realize how much I love taking care of comfort care and hospice patients. I also love oncology. Pulmonary's not my favorite. I mean, I'll admit it. So I probably wouldn't go work on a pulmonary floor, but that might actually be the stepping stone to you going into oncology. You get to see a little bit of everything and kind of figure out what you do love.
Well, thank you very much. Now we have one final question that we ask everybody on our podcast. As you've described, Med-Surg nursing can be very intense. So how do you take care of yourself?
I wasn't very good at this when I first started. And because of the support that I have from Brooke and our manager as well, it was always like, because I was always work nights, be on every meeting during the day because I wanted to be involved. And I felt like if I wasn't on the meeting, then I didn't know. But I make sure that now when I'm off, my work phone is on Do Not Disturb. No one calls me unless it's an emergency, and I will silence that. But I take my PTO, and my PTO is very valuable. And if I ever feel, I'm like, you know what, I'm worn out, I need a moment, I know my team is there to support me. Last year, I have had, unfortunately, multiple respiratory issues myself, and I just have kept getting sick, and I've had COVID 7 times myself. I had the flu, and my team, Brooke, the other assistant managers, our manager, were like, okay, we need to take care of you. And how are we going to do that once I was better and cleared is maybe you need a break from the night shift. We have a need on the day shift. Let's have you have a little bit more of a balanced work life. And I was like, okay, I'm going to do this. You know, they need me, but their goal was because they said your body might need this break. And I did it. Then I went back to nights after like a month and a half, and it's okay. This is my day off, or I'm working tonight. I'm not going to join every meeting. And it's not like I don't feel guilty because they've allowed me and they've empowered me and support me with that.
Great. And how about you, Brooke?
For me, over the last couple of years, I really try to go to the gym. I don't do anything crazy. I just like to go and do whatever I feel like doing that day. I'm not looking to be like super buff or anything, but I do find it's really good for my mental health for me to go and do the spin bike for like 40 minutes and maybe stretch. It just really sets a really good mental state for me. And I really am trying to eat better too, but most of all, on my days off, I'm really trying to not do work unless it's a meeting that I feel like I really can't miss. But I'm really, really trying to manage my time at home when I'm off to do the things I need to do at home and go to the gym. And also I spend time with my kids, who are like my favorite, and my husband too, definitely my kids, and hang out with them and plan trips with them. He's here. He probably heard me say that. I really do love to travel too. Like, so for me right now, I'm looking forward to, our family trip that we have coming up like in a few weeks. That I'm really, really excited for that, and to just completely like leave the country, leave your work phone behind, and shut this entire part of my life off for 9 days. That I need to do every 4 months or so. And it really helps me refresh and come back to work and be like, all right, what are we going to tackle? What things can we do now that my mind is clear? I think it's so important to take your PTO, which is why I love to grant it when people ask for it. Because it is, even those people who never take it because they don't travel, I'm like, just take a week off just to sit on your couch. Like if that's what you need or whatever it is you need, but don't let that PTO sit there and accumulate and do nothing with it, because it's there to help you reset, which is so, so important in a career where that is so physically and mentally taxing.
Excellent advice. Many nurses need more time to disconnect, like you suggest, Brooke. So thank you very much. Thank you, Luz, also. Thank you to both of you for joining our podcast.
Thank you for having us.
Thank you.
You guys gave great stories, and that's so engaging for the listener. So thank you for that. And I wish I could clone you.
And thank you to our listeners, and we hope you can join us next time on our podcast.